Good afternoon. Welcome to this second international webinar organized by the Clinic Advance. I'm Alba Martos, the International Vet Manager at Affinity Care, and I'm really happy to continue this international webinar season that we started last September with a great success. So I hope today you are full of energy and that you enjoy this session very much. So today we will have the collaboration of Xavier Roura. Xavier Roura is a veterinarian in the Department of Internal Medicine at the Veterinary Teaching Hospital of the University of Barcelona. So today Xavier will talk about the most frequent causes of feline lower urinary tract disease, and also we will advances in its treatment and also in its diagnostic. So, well, before we start, I would like to remind you that you can write your questions during the conference. You have a chat here in the YouTube screen, and then at the end of this session, we will answer your questions. So I will not wait any longer, and I welcome Xavier Roura. So, well, good afternoon, Xavier. Welcome to this webinar, and thanks for being with us today.
Thanks, Alba, for your introduction. First of all, thank you very much to be here. Good afternoon for the people of Europe and good night for the people of China. I am Xavier Roura, and I will talk about feline lower urinary tract disease. First of all, I will like to give thanks to Affinity for the opportunity to give this seminar. It's always a pleasure. And second, that in theory, this webinar will be in English, but as you can hear, this is a kind of a Spanglish, so I hope that you will understand all of this presentation. The slides are in English, so I hope with the slides and my Spanglish, you will understand everything. So, Alba, when do you want, we can start the webinar.
As well, Xavier, as we all know, feline lower urinary tract disease describe a variety of conditions that can affect the bladder or urethra of cats. So I think that for this webinar, as first step, it would be nice to have an overview. So if you can share with us the main causes that can cause Flutd, and then in the next question, we will move to the more specific issues.
Well, really, there is not just one cause of feline lower urinary tract disease. When we talk about this group of diseases, we talk about different causes of this disease. Feline lower urinary tract disease is a complex disease, and this is the reason because during the recent history of veterinary medicine, we have different names for the same group of clinical signs. In fact, we received during all of this time feline urological syndrome, feline lower urinary tract diseases, feline idiopathic cystitis, chronic lower urinary tract signs, or even Pandora syndrome. So if you have different names, means that it's not clear what is the situation of feline lower urinary tract disease. So first idea is there is not only one cause because are different diseases. So in clinics, it's frequent to find dysuria, stranguria, pollakiuria, even hematuria as a common clinical signs in feline medicine. In general, these kind of clinical signs are associated just with one problem, a problem in lower urinary tract disease. However, it's not just a disease. These are clinical signs that we normally find in cats in our clinic. But these clinical signs can appear alone. We can find just hematuria, or you can find pollakiuria, or crying the cat when they make micturition, or linking the perianal area. But sometimes we can find just this other clinical sign like periuria. And sometimes in cats could be the only clinical sign in feline lower urinary tract diseases. These kind of clinical signs can appear all together or can appear alone. But these are just one different disease. So when we talk about feline urinary tract disease, we really talk about different diseases that produce hematuria, pollakiuria, stranguria alone or mix or a combination of these clinical signs. All of these kind of cats that have these clinical signs, more or less 6, 7 out of 10 cats that arrived to your clinic with these clinical signs have this disease, feline idiopathic cystitis. And the rest of the cats, this other part of the cats that have these clinical signs, have other kinds of diseases inside the feline lower urinary diseases. And these other possibilities are idiopathic, urolithiasis, changes in the behavior, some anatomical deficiency, neoplasia, or even urinary tract infection disease. So we found in this part other different diseases, but the majority of the cats have feline idiopathic cystitis. So it's a complex, it's not just one cause. If not, we have different diseases that produce the same clinical signs. But all of these diseases, the most important or the most frequent is feline idiopathic cystitis.
Many thanks, Xavier. I think that it's quite clear now the full picture of Flutd. So now that we have reviewed the main causes, what do you think that is the diagnostic for this disease? I don't know if you can explain us how to interpret the different techniques that we have in our clinic.
Well, the diagnosis of feline lower urinary tract disease could be variable in the sense that there are different diseases. So we need to look for a clear diagnosis of this disease in order to treat this disease, because the clinical signs could be associated to different diseases. So the decision to do one or other kind of test or one other approach, clinical approach on clinics, depends of 3 factors. One is if it's the first time or the second time that this cat arrives to your clinic with the same clinical signs. Second, you need to remember that all of these diseases, the most frequent disease, 6, 7 cats out of 10 have feline idiopathic cystitis. And third, the age of these cats. Is this a young cat or is it an old cat? When we take these 3 factors in all together, we need to do the first time that a cat arrives to our clinic, you need to do a physical examination, complete physical examination, including orthopedic and neurological examination, in order to find potential causes that can produce the clinical signs associated to feline lower urinary tract disease. Second, we will do just one simple X-ray in order to find this urolithiasis, the second main cause of feline lower urinary tract clinical signs. In this situation, only a plain or a normal, a simple X-ray is enough, because the majority of the uroliths in cats are have opacity in the X-ray. Finally, we will do a urinalysis. And the urinalysis is important in order to find bacteria, intracellular bacteria, and to find different kind of crystal. With these 3 things, in the first time, we can decide if it's potentially a feline idiopathic cystitis, because it's the more frequent. If the cat is young, probably this is the best approach, because the most frequent cause of this clinical sign in cats lower of 10 years old is feline idiopathic cystitis. If the cat is a young cat but come back again a second time, or is an old cat, a cat with more than 10 years old, 10 years old or more, we need to do additional tests. We need to do additional diagnostic tests in order to decide which kind of diseases have this cat. In the first time, we decided just with physical examination that we probably have no other potential diseases. With the X-ray, we rule out the most frequent second cause in young cats, like is urolithiasis, because 80% of these urolithiasis have opacity in an X-ray, and we look the urinalysis looking for this kind of bacteria or crystalluria. If the cat come back again, means that the first time was not a feline idiopathic cystitis, perhaps we miss the other diagnosis, or means that the cat responds this disease to feline idiopathic cystitis, but because there are any treatment that can control totally this disease, may perhaps have a relapse. So in order to be sure that is feline idiopathic cystitis, that the only diagnosis is by exclusion of the other diseases, we need to try to be sure that there is no other kind of disease that produce this clinical sign. This in young cats. In old cats, because idiopathic cystitis is not the most frequent, in this kind of cats, we need to look for these other diseases that can produce hematuria, can produce other clinical signs like stranguria, pollakiuria, or even periuria. So, additional to physical examination, we need to do other diagnostic imaging tests like ultrasound, abdominal ultrasound, or we need to do other kind of diagnostic by the imaging test, or maybe you need to do a culture, or maybe we need to do histopathology in order to rule out a neoplasia. So we need to do other kinds of tests in order to rule out this other potential cause. If I didn't find any cause, my diagnosis will be feline idiopathic cystitis.
Okay, Xavier, many thanks for your explanation. I think that it's really interesting to understand how to diagnose fluid in cats. And seeing these slides, maybe someone can be wondering if urinalysis is really necessary or we can skip it. So can you give us your opinion about that, your experience?
So the urinalysis is not necessary. The urinalysis is required. So we need to do, in any case that arrives to our clinic, we need to do always a urinalysis because give many information for many different diseases. Of course, for feline lower urinary tract diseases is also important, but it's important in any case that we want to evaluate in our clinic. The urinalysis is important if the urine could be taken in the morning and in fast. But it's true that this possibility is difficult in cats. So in general, we can do this kind of urinalysis in cats on clinics. So before we can do the analysis before 30 minutes of the obtaination of this urine, because we obtain in cat generally by cystosynthesis, we obtain this kind of sample. Then, if we have this sample in the fridge, remember that before to do the urinalysis, we need to spend maximum 24 hours on fridge, and before to do the analysis, we need to temperate again the urine with the ambient temperature before to do any kind of analysis, in order to avoid several mistakes that appear that could be appear with this urinalysis. In fact, what is important for feline urinary tract disease. For one side, urinary specific gravity, because the majority of these cats with feline lower urinary tract have a very concentrated urine. So in general, more than 1,035. In general, 1,045, 1,050, 1,060, 1,070 is quite frequent in cats. So if we find a cat with a isostenuric or moderate concentrate urine, means that this cat have a feline lower urinary tract disease, but have additional diseases, because in this kind of diseases that produce feline, like the clinical signs of feline lower urinary tract disease, the concentration in general is very high. And later, we need to always do in the urinalysis, we do an evaluation of this urinalysis in the microscope, looking for bacteria, looking for intracellular bacteria in order to confirm a urinary tract infection, or we need also to evaluate the presence of crystalluria. But we need to remember that in feline lower urinary tract disease, the presence of crystalluria doesn't explain the clinical sign, because crystalluria cannot produce hematuria. Urolytes produce hematuria. Urolytes produce dysuria, but crystalluria in general doesn't produce this clinical sign. And need to remember that this potential crystalluria means the risk that potentially the urolyte that you can find is produced by this kind of mineral, or can explain that potentially in the future have many factors to produce new urolytes with this kind of mineral, but doesn't explain the clinical signs. The clinical signs need to find a urolyte.
Okay, Xavier, we know now a little bit more about urinalysis and how to understand it. But now I would like to ask you about the pseudomembranous cystitis, which is we know that it is an unusual condition associated with obstruction. So what experience do you have in the clinic with this pathology?
Well, we talked that feline lower urinary tract disease is a quite complex disease, because at the end it's not just one disease. Our clinical signs, the same clinical signs associated to different causes or to different etiologies, so to different diseases. So are different disease in a cat that produce the same clinical signs. Until very recent, we always think that urinary tract infection is quite infrequent. But in 2011, the French colleagues described a kind of different presentation with the same clinical signs, obstructed cats, but produce the clinical signs of cystitis, but they are a different explanation. For them, is a new etiology, a new disease, and the name of the disease is feline pseudomembranous cystitis. This kind of disease were described also 4 years later by another study in UK, where inside a big group of cats, described 4 cats with this kind of ultrasound description that can be similar to the description of the French colleagues. And these authors also say that potentially we have a new cystitis with the name pseudomembranous feline cystitis. Finally, in the 2018, we described a case series of 3 cats with this also the same presentation, cats with this kind of pseudomembranous cystitis. So means that probably we have a new entity inside these feline lower urinary tract diseases. So the clinical signs, the obstruction, or the clinical signs of hematuria, dysuria, pollakiuria, stranguria could be associated to this other disease. When we talk about the potential explanation of this new disease, we talk about cats that in general have a feline lower tract disease presentation, classical feline lower tract disease presentation, but always in general obstructed. So there is an obstruction in these cats. It's the same disease, but obstructed. The hematological, the biochemical, even some radiological alteration, and similar to the other diseases, but the potential explanation of this new disease is probably a urinary tract infection. So successfully respond to the use of treatment with antibiotics, and helpfully we can diagnose this kind of disease just with abdominal ultrasound. So in young cats with this kind of presentation, especially if there is obstruction with presentation of feline lower urinary tract disease, perhaps not only a radiography is necessary. Sometimes could be important to do this kind of abdominal ultrasound in order to describe or find this abdominal ultrasound alteration. So general mild distension of the bladder and severe increase with diffuse areas of the wall of the bladder, and finally this pathopneumonic presentation of clinical signs of ultrasound lesions that we can describe. So this kind of bands, some of them mineralized bands that cross the bladder, the inside the bladder, and are pathopneumonic of this feline pseudomembranous cystitis. So probably in cats we have a new description of urinary tract infection, just with antibiotics respond to this disease, but probably this disease could be necessary to do abdominal ultrasound in the first description, in the first presentation of the cat in your clinics, because these cats usually are restricted, and if you do just an X-ray, the normal protocol for a young cat, the first time that arrive to your clinic, in these cases, you cannot diagnose because you need the abdominal ultrasound.
Okay, thanks, Xavier. I think that it's quite fascinating to know the latest things we learn each year or each day in our clinic. So thanks for your explanation. But now going back a bit to the main cause of Flutd, feline idiopathic cystitis, we know that the treatment has evolved over the time, so we know more and more things. So what do you think that now is the best treatment for that disease?
Well, when we talk about, or we use this name, idiopathic, means that we have not a real cause, so we cannot have any perfect treatment. So when we have clinical signs that we include a suspicion of feline idiopathic cystitis, we need first to try to do a diagnosis. First, exclude the other potential causes of these clinical signs. So we need to exclude urolithiasis, urinary tract infections, neoplasia, and other kinds of behavior problems. So we need to exclude the other potential cats in order to make a diagnosis of feline idiopathic cystitis, because feline idiopathic cystitis has not diagnosis. The diagnosis is for exclusion of the other potential diseases. When we have this kind of diagnosis, feline idiopathic disease, so we need to treat. But as the name says, idiopathic, we don't have a perfect treatment because we don't know exactly the cause. So feline idiopathic cystitis, in general, we assume that is a kind of immunoneuroendocrine alteration that don't allow the cat to respond adequately or to adapt adequately to the environmental changes. producing fear, producing anxiety, and sometimes pain. And this pain, this anxiety, this fear produce other kind of changes that at the end produce the clinical signs associated to feline idiopathic cystitis. This kind of disease is very similar in humans, where this kind of disease is also described, and the etiopathiology is probably the same. So, because we don't have any potential good treatment, because we don't know exactly the cause of these immuno and neuroendocrine alterations, we just can do a re-evaluation. We can do a kind of changes in the environment, in the diet, in the life of this cat, in order to decrease the fear, the stress, the anxiety, the pain, all of these situations. And are the only treatment, because the cause of feline idiopathic cystitis is an immunoneuroendocrine alteration. So we don't need to use antibiotics, because this kind of disease, even if you don't do any kind of treatment, improve alone between 2 to 7 days. So sometimes in veterinarians, we use antibiotics because we found hematuria or we found pollakiuria and we think about urinary tract infection. If we confirm that the diagnosis is urinary tract infection, we need to give antibiotic, because if not, if it's a feline idiopathic cystitis, we can improve, but doesn't improve for the antibiotic. The antibiotics can produce resistance and other problems, so we don't need to use antibiotic if the diagnosis is feline idiopathic cystitis. Furthermore, this kind of disease can relapse again if we don't do any treatment. So the treatment need to, the objective or the target of this treatment are to avoid the relapse or try to reduce the frequency of this relapse, because we don't know the cause. So this kind of alterations, this kind of pain, stress, changes in the neuroendocrine alterations produce probably in dogs with this cat this feeling of pain, this feeling of fear, of anxiety. Also looks like can produce a decrease of the glycosaminoglycans protection inside the bladder, and the urine, that we know that in cats this urine is usually with very concentrated, can increase this excitation of this inflammation, but neuronal inflammation, this feeling of pain, this feeling of anxiety, this feeling of fear. So this kind of concentrate urine also increase or worse these clinical signs. So at this point, because we don't know the exact cause of the feline idiopathic cystitis, and probably everything is connected to the concentration of the urine, the composition of the urine, and also this feeling of anxiety, this feeling of stress, this feeling of fear, the treatment of the feline idiopathic cystitis is a multimodal treatment. So there is just one treatment. For all of these treatments or potential treatments for the feline idiopathic cystitis, these three are the most important. So we look to decrease the urinary specific gravity, because if you decrease the urinary specific gravity, this urine can irritate less the bladder. Second, the diet. The diet can change the composition of the urine and also could have different compounds that maybe decrease the anxiety, the pain, the fear of this cat. And finally, environmental enrichment that can produce also an increase of the the increase of water, of to drink water for the cat, and also decrease, of course, this feeling of stress, this feeling of the fear of the cats. The other treatments, analgesia, feline pheromones, the use of some drugs that could decrease the stress in the cats, or the use of glucosaminoglycans, or even antidepressants drugs. All of these other treatments could be associated to these three treatments. But these three are the best treatment of feline idiopathic cystitis. So a combination of these three treatments plus the other treatment could be this kind of multimodal treatment that have efficacy in the control of the feline idiopathic cystitis. How you can decrease the urinary specific gravity? So increasing the drink of water for the cat. And with this could be produced by this use of fountains that produce a clear, fresh, and change frequently this water. So for the cat is an increase of for drinking, an increase of the moisture for drinking, but also, and it's important, the diet play an important role in the control of feline idiopathic cystitis. For one side, changing the composition of this urine, so decrease the irritation of this urine to these neurons, and also produce changes in the decrease of the urinary specific gravity. Our objective is decrease this urinary specific gravity in order to decrease the anxiety, but also decrease the potential association of new clinical signs. This kind of prescription diet would be very useful because are potentially one of the best treatment in order to decrease the urinary specific treatment, urinary specific gravity of the urine, and can produce and decrease of the stress, decrease of the potential neuroendocrine alteration that could produce this other feline idiopathic cystitis. So the environmental enrichment could be the third approach to the feline idiopathic cystitis in order to improve that the cat eat better or drink better. This is more active. If the cat is less stressed, they can eat and drink more. So decrease the urinary specific gravity, improve the behavioral situation, or we can do other kind of environmental enrichment, like increase the quantity of cat litter boxes, or make the environment more complex in order that activate the behavior of the cat, or provide play or areas for exploration, so can increase the activity of this cat and probably prevent and treat other potential social conflicts with other cats or even with the owners in order to improve this kind of neuroendocrine situation that perhaps can improve the feline idiopathic cystitis. So, multimodal treatment where diet, decreased urinary specific gravity, and environmental enrichment are the three more important parts of this treatment.
Thanks, Xavier. I think that now we have clear information about how to treat feline idiopathic cystitis. So, well, as we have been saying, this feline idiopathic cystitis is one of the main causes of Flutd. But what about urinary tract infections? Are they just as frequent, or what's your opinion about that?
Yes. Traditionally, when we talk about urinary tract infection in cats, in general, in the last more than 20 years ago, most of this, all the descriptions say that cats with these clinical signs have a low frequency of urinary tract disease. Other description talk about urinary tract disease, urinary tract infection in cats are relatively rare. Or even we have cats have low prevalence of urinary tract infection with percentage even lower than this 3%. So in general, all manuscripts or all scientific publication talk about that urinary tract infection is quite infrequent in cats. Probably this is true in the sense that in young cats, probably in young cats, in cats with less than 10 years of age, this is true because probably there are many few cats that have urinary tract infection in this situation. In fact, in several descriptions, all the old studies talk that young cats have more probably idiopathic cystitis, and young cats in general have very low infections if you compare with older cats, so cats with more than 10 years or more years of age of these cats. So infection looks like frequent in all cats, infrequent in young cats. However, this all concept, this all opinion, so urinary tract infection basically is a disease of all female cats. This change, this concept have changed with the pass of the year. And recently, we have the impression that there are many other factors that can increase the percentage of cats with urinary tract infection, especially young cats, new diseases. For example, feline pseudomembranous cystitis is a new disease that maybe is an infectious disease, urinary tract infection. So probably in young cats, some young cats have more new presentations of urinary tract infections. Or the use, for example, of stents. In the last year, increased the use of subcutaneous bypass or the use of stents to treat urinary tract diseases, to treat urolithiasis, so to treat different other new situations. And these new treatments can produce an increase of the urinary tract infections. For example, we need to remember that in human, the development of this subcutaneous urethral bypass was developed many years ago. And in veterinary medicine, this is quite recent. In the last 10 years, appear as a more frequent the use of this kind of subcutaneous bypass or the use of stents. So this data that we found that in human, we found close to 50% to more than 19% of the humans with urinary stents, we found a urinary tract infection. Now, maybe this is also described in cats, because in cats, recent studies have described that more than 50% of the cats with this kind of stents, with the use of the stents or the use of other kind of bypass like subcutaneous urethral bypass, can reduce or increase the presence of urinary tract infection. So this impression that is increasing the urinary tract infection also has been confirmed in several studies. We did this study 2 years ago, and we talked and we present this study in 2019. And in this study, in the evaluation of urinary cultures in other dogs and cats, we found that in cats, close to 25%, so 1 out of 4 cats that arrive to our clinics with clinical signs of potential urinary tract infection have a real infection. So looks like urinary tract infection is not so infrequent like we talked in the past. Now we need to include in young and even in all cats, but even in young cats, we need to include urinary tract infection in the differential diagnosis of feline lower urinary tract disease.
Thanks, Xavier. So following the item of the infections in cats, if we have a positive culture, can you share with us how to interpret it? And following that, what is the best way to treat the animal?
Well, the fact that the increase of the urinary tract infection looks like in cats are growing. And the second, that the overuse of antibiotics in cats for other reasons, for example, to treat feline idiopathic cystitis, have produced a kind of problems in the approach of urinary tract infection in cats, in dogs and cats, but now we are talking about cats. Urinary tract infection looks like more frequent than in the past. And some kind of infection that in dogs we well know now also has been described also in cats. For example, prostatitis, pyelonephritis, chronic cystitis, and this kind of urinary tract infection is increasing because we use catheters and we also increase the use of this kind of new surgeries, of this kind of new treatments associated to urinary tract diseases. So the use of stents, the use of subcutaneous bypass, urethral bypass, all of this kind of new device that are using in surgery can increase the variability of different kinds of urinary tract infection. So cats look like increase the urinary tract infection. So we need to an approach and a guideline in order to all of the veterinarians work in the same time, with the same protocol, in the same way. So these guidelines published in the 2019, so 1 year, have just 1 year, explain very well what is the treatment, the approach, the management of the infection, of the urinary tract infection in cats. And one of the most important things that we can take for these guidelines in cats is that we need to treat patients, we need to treat cats, we don't need to treat laboratory results. So this means that we don't need to treat infection. If we found an infection, a culture, a positive culture, it's a positive culture. This does not mean use of antibiotics. It just means that we found a bacteria in the urine. So we need to treat the patient, the cat. The cat needs treatment because have this infection in the urinary tract. Sometimes yes, sometimes no. So this is one of the first important points that point out these guidelines. Another important point is that when we need to use antibiotic for the treatment of urinary tract diseases, we need a urinary culture. Without urinary culture, we cannot approach adequately this kind of treatment in cats. So we need always the culture, the urine culture. When we have this situation, so increase the use of antibiotic, increase the use of resistance, we as an overuse of antibiotic in cats, most of these diseases that we found that produce hematuria, pollakiuria, stranguria, periuria are not infections. We need to approach the different situation in a different way. For example, if we have a previous infection, we have a previous urinary infection in a cat that we will do a kind of surgery, and that moment we know that has a previous infection, perhaps even if there is not any clinical sign associated with this infection, perhaps makes sense to use antibiotic. However, in the other hand, if we have a surgery of stent, to put a stent or to put a subcutaneous urethral bypass, and this kind of cat has not infection, there is not at this time clear if we can use antibiotic as a prevention of the potential infections that could appear later. If this infection appears later, we will talk about this. We don't use antibiotic as a prevention to put a urethral stent or other kinds of devices in the urinary tract. So, in general, the new guidelines say if I have a cat without clinical signs of urinary tract infection, without any clinical sign of urinary tract infection, even if I have an infection, this cat no need treatment, no need antibiotic. So we don't need to give antibiotic at this kind of cats. Even if this cat has no clinical signs, together with a multi-resistant bacteria, even in this situation, we don't need to give antibiotics. Always we need to give antibiotic if we have a risk of systemic infection. For example, we have a pyelonephritis, could make sense because it's an hematogenous infection in general, could have a sepsis associated to this pyelonephritis. But only in this situation, we can take antibiotic as a prevention. If we have clinical signs, we need to give treatment, we need to give antibiotic after urinary culture. And this is important in order to avoid the overuse of antibiotic, but it's also important in two situations for the management of dogs and cats. Because now we have many resistance described in bacteria of the urinary tract. So we have many resistance in the urinary tract. That means that we will have problems to treat most of these bacteria when the antibiotic is necessary. So when we have clinical signs. So this study, this European study that we did in 2016, demonstrates this. We have many bacteria that now are resistant in the urinary tract of the dogs and the cats. And this is probably described in Europe. I'm sure that is also described in other parts of the world. So it's important to avoid the excess or the overuse of antibiotics in dogs and cats. But also, this kind of treatment of the urinary tract infection is important to follow this recommendation of the guidelines because we have an important problem of resistance of bacteria in humans. So we have a problem also of resistance in human medicine. So we know that the control of this resistance could improve the control of the urinary infections in humans, dogs, and cats. And perhaps the use of raw diets could increase the risk of introducing new antimicrobial resistant bacteria because in general, in this kind of diet that are not controlled, health control of this diet thus can control the excess of enterobacteria. And this kind of enterobacteria now is one of the big problems of resistance in humans, but also in dogs and cats. So the girls avoid the use of raw diets could also improve the control of infection, could improve the control of resistance of these infections in dogs and cats, but even more important, perhaps control the increase of resistance on several enterobacteria or even other bacteria in human medicine.
So yeah, yes, I agree with you that antibiotics we have to keep them in mind and use them in our best way. So now I would like to move to the urolithiasis in cats, which can obviously trigger also a Flutd picture. So in your opinion, how important is urolithiasis in cats and what are the situations that you normally find in your clinic?
Well, the situation of the urolithiasis is important. Yes, it's important in cats, in dogs and in cats. But in cats, it's important because we know that probably close to 70% of the cats with clinical signs of lower urinary tract have feline idiopathic cystitis. This kind of feline idiopathic cystitis is the most frequent. But because this kind of feline idiopathic cystitis could not be diagnosed directly, we need to exclude the other causes in order to confirm the feline idiopathic cystitis. And the most frequent cause out of feline idiopathic cystitis is urolithiasis. So urolithiasis is the second cause of feline low urinary tract clinical signs. So these clinical signs associated to different diseases could be associated to urolithiasis. So yes, urolithiasis is frequent in cats. And we need to include in the differential diagnosis of hematuria, colachiuria, stranguria, leaking of the perineal area, and other kinds of clinical signs associated to lower urinary tract, because it's the most of the uroliths are found in the low urinary tract. So you can find them in the bladder or in the urethra. But you need to remember that urolithiasis is formed, the urolith was formed or in the pelvis of the kidney, or in the bladder. So we found the urolith that is formed in the bladder, but we can also find the urolith that was formed in the kidney that go down through the urethra to the bladder. So the low urinary tract have many of these, the presence of many of these uroliths. When we need to look for uroliths in high urinary tract, in this area is more useful the diagnosis by ultrasound, but is lower, the presence there are less frequent than not in low urinary tract. Furthermore, it's clear that more than 80% of the uroliths in the cat are secondary to calcium oxalate or struvita. So means that the normal X-ray we can find this kind of urolites because are produce opacity in the X-ray. This is the reason that in young dogs, we can use the X-ray as a first test the first time that arrive to our clinic with this kind of clinical sign. If we found one of these urolites, we can explain the cause of this clinical sign by this urolite. But if we don't found, this means or this is in the high urinary tract, or perhaps have not enough size, or are localized or are produced, by other kind of mineral, like xanthina, other kinds, cystina, other kinds of mineral. So the struvita in urolites in the kidney are very rare. We can find this kind of urolite always in the lower urinary tract. So we can find them in bladder or in urethra. So the diagnosis of urolithiasis means the use or combination of course, physical examination, localization of these urolites by X-ray or by abdominal ultrasound in order to find this radio opacity or radiolucency associated to urolites, and the evaluation of the urine in order to potentially medically treat this kind of urolites. Why the X-ray, the simple X-ray the first time? Because 80% or more than 80% of the cats have calcium oxalate or struvita urolites. So we need to find these urolites in cats. So if we need to localize this kind of urolith in areas that can explain the presence of these clinical signs. If we found this urolith, we can say the urolithiasis is the real diagnosis of the clinical signs of this cat. In other situations, we will need probably the abdominal ultrasound for localization of this kind of uroliths in other positions, or to localize this kind of uroliths that cannot produce opacity in the X-ray, or abdominal ultrasound in the bladder. So for this kind of other kinds of uroliths that could find in the lower urinary tract. In X-ray, what have not radio opacity, we can use this kind of other diagnostic tests. But remember that these three other potential uroliths perhaps could be potential uroliths, or perhaps could be bubbles of air localized in the urinary bladder. This other situation of this kind of uroliths are more probably that these are a urolith, a real urolith, and not bubbles, because the localization is not associated to the bubbles of air.
Thanks, Xavier. Following the urolith explanation that you gave us in the last slides, I would like to ask you what is the therapeutic importance of supersaturation index in that cases?
Yes, we have talked that the urolithiasis is quite important in cats, especially in cats that arrive to our clinic for clinical signs of the lower urinary tract. But in the last years, approximately in 2016, appeared these guidelines of the American College of Veterinary Internal Medicine about the management of the urolithiasis in dogs and in cats. And one of the important targets that explain these guidelines about how we can manage very well the urolithiasis in prevention and also in treatment is the concept of the supersaturation index. Supersaturation index means the probabilities that a urine, in a kind of urine, we can produce finally the production of a urolith. And supersaturation index increase when we have good conditions for the production of these uroliths. So if we have a urolith, or we want to prevent an urolith, we need to evaluate this kind of supersaturation index. The medical treatment, or even the prevention of urolithiasis, need and is based in this relative supersaturation index. And how do we manage this supersaturation index? This supersaturation index needs to evaluation of the urinary specific gravity, need the evaluation of the quantity of crystalluria we found in the urine, and need also the evaluation of the pH in the urine. These three factors are the important factors in the relative supersaturation index. These two, urinary specific gravity and quantity of crystalluria, could be reduced adequately for all the kinds of uroliths. So we have different options in order to decrease this urinary specific gravity and the quantity of crystalluria. However, the pH could be different depending of the urolith that we have. So sometimes this kind of the pH is more difficult to control or adequate to the as a perfect situation for in order to treat or in order to prevent the urolithiasis. So how you can decrease this supersaturation index? But the most easy way is to reduce the urinary specific gravity. we need that the cat move the urinary specific gravity between 1020 and 1022. Approximately 1022 is a nice urinary specific gravity in order to control or prevent the urolithiasis in cats. And we can do this using an increase of water consumption. This is sometimes difficult in cats, but we can do this with the use of fountains or with the use of different diets, humid diets or dry diets that are humid by hot water, for example. Or we can use prescription diets that could be reduce the urinary specific gravity, even if it's wet, or even if we can wet this dry prescription diet with hot water, or use directly canned prescription diet. This could allow the treatment of this urolithiasis, reducing the urinary specific gravity. Sometimes it's not possible to change a prescription diet for urolithiasis because the cat have other diseases that could be necessary to use other kind of prescription diets. And most of these diseases sometimes are more important than not the urolithiasis. So, for example, we can have hyperthyroidism, or we can have diabetes, or we can have a cat with chronic kidney disease. So they need other kinds of prescription diet, perhaps, that need other kind of diets than not a diet for urolithiasis. In this situation, in order to decrease the urinary specific gravity, because it's necessary for control or for prevention of the urolithiasis, we can wet this dry prescription diet with hot water, or you can use this other prescription diet in a format of can in order to decrease the urinary specific gravity. Other important treatment is the use of, for prevention and treatment of the urolithiasis, is the use of diets, prescription diets for urolithiasis. Why? Because can reduce the crystalluria, one of the other factors important in the supersaturation index, and because can control the pH. So with prescription diet, if it's possible, we can treat the three factors that are important for the control of the supersaturation index. So we can reduce the crystalluria with the use of prescription diet. We can control the pH, and we can control the we can produce a decrease in the urinary specific gravity using canned prescription diet or using dry prescription diet that could be wet using or mixing with hot water. This is the best treatment to decrease the supersaturation index. Very important in the medical treatment and in the prevention of urolithiasis. Why is important? Because we only can decrease the size, we can treat the urolithiasis medically, or we can reduce we can prevent the growth of this urolithiasis is with the urine that are in the pelvis, in the bladder. The urine in the bladder and the pelvis need to be in contact with the urolith in order to decrease the size, in order to treat medically this kind of urolith, or need to be the urine in pelvis or in bladder can produce this effect of prevention, because it's where the formation of the urolith is possible. So the diet can reduce these changes and improve the reduction of crystalluria, control of the pH, and reduction of the urinary specific gravity. This kind of prescription diet could be also associated with the use of other drugs to decrease the crystalluria, or the other treatments in order to decrease the crystalluria. But prescription diets could be the most important tool in order to treat the urolithiasis or prevent urolithiasis.
Thanks, Xavier. So we are almost at the end of this session. So as our last question, I would like to ask you if you can share with us a recap about when and how could we medically treat the urethral
Yes, last question is one of the most important because in the last years appear more frequently cats with problems of high urinary tract diseases. So we find different diseases that affect this part of the tract, and this part of the tract means that we have presence of uroliths in kidney, pelvis kidney, or in the urethra. But in the pelvis kidney or in the urethra, this kind of uroliths can be or is necessary to form this kind of urolith to be in the presence of this high supersaturation index in the pelvis. Remember that urolithiasis is frequent. Urolithiasis in the high urinary tract are usually formed by oxalate, calcium oxalate. You need to remember that the place where the urolith is formed or the place where we can treat the urolith could be in the bladder or in the kidney pelvis. So we need to change or move the urolytes that are in the urethra or in the urethra to the bladder in order to treat this kind of urolith or in order to do other things with this urolith. Because in the urethra or in the ureter it's not possible to treat with it's not possible to treat this kind of uroliths just with medical treatment. So the urethra to the bladder, which is a place where I can treat, is easy in general, but from urethra to bladder is more difficult. And also is more important because sometimes we don't know that is really obstructed. There is a real obstruction of the urolith in the urethra. So this kind of obstruction is important because with the pass of the time with a urolith obstruction producing an obstruction in the urethra, increase the worst of the kidney function. So it's very important a kind of diagnosis, an early diagnosis, in order to treat this urolith, in order to avoid the potential obstruction, and in order to try to prevent new urolytes in the urethra. So, how I can do an early diagnosis? An early diagnosis is necessary with the abdominal ultrasound. We see, we explained before that urolithiasis in the lower urinary tract is quite easy to diagnose. In general, just with X-ray is possible. But in the high urinary tract, it's more difficult, and abdominal ultrasound could be more important for this diagnosis. Pilotasia is the increase of the size of the pelvis can inform us about the potential obstruction of the urethra. If we have more than 13 millimeters, we are sure that we have obstruction. But we need to remember that close to more than 25% of the cases, we cannot diagnose an obstruction just with abdominal ultrasound. So probably we need to do an early diagnosis, doing or thinking about potential obstruction with urolithiasis when the pelvis is still not too much dilated. So when we have a pelvis with more than 7 millimeters, we can say potentially there is an obstruction, or if we have between 5 and 7 millimeters, we say sometimes we could have an obstruction. So if we have clinical signs that can be suspected of obstruction or urolithiasis inside the urethra, or we have a supersaturation index, very high supersaturation index, we need to avoid, and we need to avoid the potential obstruction. So we need to do an early diagnosis using less dilatation as a diagnosis of obstruction of the urethra. So the treatment, the medical treatment in general is useful, but only medically, it's only one of every two cats with obstruction, and this is obstruction is the urolith, the size of urolith is less than 5 millimeters, we can obtain a successful medical treatment. But we need to treat always with medical treatment before to use more invasive and expensive techniques in order to descend this urolith from the urethra to the bladder. Even if we obtain this kind of desobstruction, even if we put the urolith from the urethra to the bladder, sometimes the azotemia doesn't improve. And this is important, but this situation is the same that in other situations using devices like stents. So make a solution of an obstruction doesn't mean that we can obtain a solution of the kidney function. But today, it's important if we have a suspicion of urethral lithiasis to use fluorotherapy, increase the diuresis, and to increase the diuresis together with the use of some relaxant of the muscular of the urethra. For example, prazosin or tamsulosin alone, or in combination the both drugs. Could be interesting in the sense that they produce this, go down the urolith from the urethra to the bladder. Analgesia is still controversial, the use of analgesia in this kind of cats. In human medicine, we know that this produces several pain, so makes sense if we have a suspicion of urethral lithiasis, use the other treatments, but together use the analgesia in order to try to improve the response to this medical treatment. This kind of medical treatment is successful sometimes, and we don't have enough evidence that could be the best treatment. But at this time, it's very interesting to use the medical treatment as soon as possible in order to prevent obstruction and in order to make a solution of this urolithiasis. So we're right at the end of this webinar. We have the different answers of the different questions that we can do in clinical appear in our clinical practice. And probably the main conclusion of this webinar is we need to follow this kind of standard protocols or the recommendations in the guidelines, in the given by the expertise, in the sense that the adequate management, the adequate use of protocols, the adequate clinical approach is the best way in order to treat, manage, and probably prevent the feline low urinary tract diseases. Any clinical sign associated to feline lower urinary tract is potentially associated to one of these diseases that produce feline lower urinary tract disease. So urinary tract disease is not just one disease, it's the compendium of different diseases that produce the same clinical signs, but we need to approach the different way in order to make a solution. So thank you very much for your attention. I hope that you understand all the presentation, and this presentation can help you in your work on clinics. And now, if you have questions, I will try to answer all of these questions. Thank you for your attention.
Thank you, Xavier, for sharing with us your knowledge. Well, I think that it has been a quite interesting webinar, and we have learned a lot. So I have seen that some attendees have written their questions on the during the conference. So now we will move to that questions to answer them. So before the first question, I would like to remind you that you can subscribe to our YouTube channel. So in that sense, you will be updated with the next webinars and also with the post that we will include in our website. So Xavier, we will start with the first question. The first one, it's from Mexico, I think, and it's about how do you handle analgesia and which antibiotics are the ideal ones?
Thanks, Alba. For analgesia in general, we use buprenorphine. I think I put this in the slides, but it's not. I use buprenorphine and buprenorphine oral. That is I think the best analgesia for cats. And usually you spend 4, 5 days, 6 days, depending of the cat. But in general, in 5, 6 days is enough to maintain, to reduce the pain, especially to reduce the spasm in the urethra. And for the antibiotics, the ideal is to use the antibiotic that is associated with a culture and the response of the antibiotics to this culture, but is not in general. Cephalosporins could be a good antibiotic, or if not, amoxicillin could be another good antibiotic for the treatment of this kind of urinary tract infection in cats.
Okay, many thanks, Xavier. And in the cases, the second question that we have received is that in cases of urolithiasis, do you always need a prescription diet, or how do you manage the diet in that cases?
It depends of the situation of the cat. Sometimes, if it's a very obese cat, for example, it's better to use some kind of diet, a diet to decrease the weight of the cat. But we need, for example, increase the quantity of water. So sometimes it's better to increase the water, putting water in this dry food, or using a kind of diet for the obesity in a humid diet. But if not, in other cases, could be interesting to use a prescription diet for urinary for this kind of urinary situation, especially urinary stress, but always the same. If the concentration of the urinary specific gravity is very high, if we have more than 1030, is necessary to increase the quantity of water. So you can use a prescription diet, but humid with water, or a prescription humid diet directly, in order to use a prescription diet for urolithiasis or for the urinary problems. In this case, interstitial cystitis, for example, but associated with humid or with water, depending of what they like more to the cat.
Okay, thanks. I think that's clear now. So the third question we have, it's how do we manage urinary tract infection after the removal of an urinary catheter of a cat with feline idiopathic cystitis? Can you share with us your opinion about that?
Well, it's quite complex, but in general, if you demonstrate that you have an infection and the cat have clinical signs associated to this infection, you need to treat. So just because you remove urinary catheter doesn't mean to use antibiotic. If the cat has interstitial or idiopathic cystitis, is not necessary antibiotic. But if you demonstrate that this cat has an infection doing a urinary sediment, and you describe it, you can see this bacteria inside neutrophils or other cells, and you demonstrate that this cat have an infection, you can use antibiotic even or secondary to remove the catheter or secondary to idiopathic cystitis, but just if you demonstrate that you have an infection at that moment.
Okay, thanks, Xavier. The next question that we have received, it's about if we can use phenoxybenzamine in cats with this disease, with feline idiopathic cystitis. So I don't know if you can give us some tips about that.
Yes, you can use. In general, we use prazosin. That is probably produce more relaxation of the urethra, but there is other possibility, and one of them is phenoxybenzamine. We don't talk, or I don't talk about phenoxybenzamine because it's not possible in Spain to obtain this kind of drug regularly. So we use prazosin because it's the only drug that you can access here in Spain, but of course you can use perfectly phenoxybenzamine.
Okay, Xavier, thanks. And the last question is that when we have bacterial cystitis, that it's confirmed by culture, how long we recommend the antibiotic treatment? And also, when we have given the cat the treatment, if we do you recommend to retest it with a culture or not? What's your experience in that?
Can you repeat the first part of the question, please?
Yes, if we have a bacterial cystitis that we have diagnosed by culture, how long do we have to give to the cat antibiotics?
Okay. So if it's the first infection, now the guidelines recommend the use of antibiotic during 1 week, maximum 10 days, if it's the first infection. If it's a chronic infection, the recommendation is a little more longer. Sometimes you can arrive to 3 weeks, but always you need to treat the predisposition factor for this chronic infection. If you don't treat this predisposition factor, you always will have this infection. So the time now has been reduced, and in general, just 1 week is enough in order to treat this kind of infection if it's secondary to the first infection or is secondary to a catheter or something other.
Okay, so well, I think that we are at the end of this webinar. So many thanks, Xavier, for being with us today, and all people that have been connected with us. Well, this is the latest webinar this year, so happy Christmas to all of you, and I hope to see you next year here. Thank you very much.
Thank you very much. Bye-bye.
Bye-bye.